Assalamu alaikum. Today we are here. I have a very excellent patient. She is actually had came to me with the complaint of pain in left hypochondrium of the abdomen. While on my examination, I had found that the patient is having massive splenomegaly. Today I am going to teach you about how we are going to examine the abdomen, especially for the splenomegaly. So let's start with the patient. Whenever we are going to examine any of the patient to do any systemic examination, there are basically 4 parts of that examination. And starting from the inspection, palpation, percussion and finally auscultation. For the abdominal examination, we have to focus for these 3 especially: inspection, palpation and percussion. So we are going to start with the inspection. हाथ सीधा रख जा. अच्छा, अगर तू बुरो न मनाता जो तमीज तुझे मथे करे ना इस तरह लेकर है तो बढ़ता है. हाँ. So after taking permission from the patient, I had exposed the abdomen of the patient. Actually, in our circumstances, we cannot fully expose the area to be examined for the abdominal examination as she is a female. But I am very much thankful to her that she had allowed me to expose. So, starting with the inspection, we have to first inspect the shape of the abdomen to see any asymmetry in the abdominal shape, and second important thing, position of the umbilicus. Moreover, we have to examine the patient for any scar, any pigmentation or any prominent veins over the abdominal cavity. As we are concerned with the examination of just splenomegaly, so I will focus on the examination regarding or related to the enlargement of the spleen. So have a look on the abdomen of the patient. You must be able to recognize that there is slightly elevation or there is some sort of asymmetry on the left hypochondrium of the patient, which is easily visible and can be demarcated or differentiated from the right hypochondrium. So on inspection, we are able to notice that there is bulging or there is swelling or there is some sort of asymmetry in the shape of the abdomen, which can be seen on the left hypochondrium easily. Proceeding with the palpation, we have 2 major parts for the palpation: superficial and the deep. Superficial palpation is done usually to see the tenderness and to slightly judge your abnormality noticed. For the spleen, we have to go for the deep palpation, and for the deep palpation, another important point to be remembered is whenever we are going to examine the spleen, we have to use our both hands. One hand should be placed over the costal margin of the left side. Another hand you have to place over the right iliac fossa. To palpate the spleen, we have to proceed obliquely, starting from the right iliac fossa and going towards the subcostal margin or to the costal cartilages or to the rib cage. So starting with the splenic palpation, do it superficially, slightly press the abdomen. See, I am able to palpate the hard mass over here, just nearer to the umbilicus. Then for the deep palpation, you have to remember to ask the patient for deep breathing with open mouth. बात खोले बड़ो साफ खण जा, ठीक है? जडे में हाथ रखा, बात खोले बड़ो साफ खण, ठीक है? हाँ, बात खोले बड़ो साफ खण. शाबाश, वरी, शाबाश, वरी, शाबाश, शाबाश. Here I found the, ठीक है? Here I found the mass which is touching my fingertips. I will try to locate its boundaries. ना ना, तू आराम से साथ खंड बसाने, आराम से साथ. These are the well-defined boundaries. To further confirm it, ask the patient to turn towards your side. मोर पास हो रहा है. मूवट पास हो रहा है शाबाश हाथ के ये रखे छट इन हाथ के हेठ रख अगेन पुट योर लेफ्ट हैंड ओवर द बैक ऑफ द chest and confirm your swelling with your hand and it's much demarcated. If you will try to locate the rib cage, here is the margin of the rib cage and this is actually the spleen of the patient. We usually use inch tape to measure its size perfectly. If you are not having the inch tape, then you can have judgment slightly with your hand by putting the fingers over the swelling. This is the lower boundary. Put your fingers like this over here. 4, 8, 10. So the spleen is round about 10 centimeter, 10 fingers below the left subcostal margin. To further confirm it, we have to do the percussion. Percussion is also done starting from the right iliac fossa up to the left subcostal margins. ये आऊँ थोड़ा धक्का ना तुम ठीक है सूर तक बोले ना ओ ये
काथे आंदी
ये इतने
इतने खले इतने
भले हाँ
इतने
proceed it as you go towards the swelling or towards the mass. Dullness is there. Percussion note changes from resonant to dull. This is the confirmation for the splenic enlargement. Another important point is to differentiate between the spleen and enlargement of the kidneys. The very simple points to be remembered in enlargement of spleen and the kidneys is that you cannot go above the swelling if the swelling is spleen. Secondly, you cannot mark the upper border of the spleen. Thirdly, this swelling will move with the respiration. Number 4, there must be a splenic notch. And finally, the spleen is enlarged crossing the umbilicus towards the right iliac fossa, while the kidney is enlarged in longitudinal manner. As this is the case of the splenomegaly, so we don't need to complete our examination with the auscultation manual. So here completes the examination for splenomegaly. Thank you.